Hey, it's Mr. Shrum, and welcome back to the lesson for nervous system 1 issues. So, today we're going to look about what can go wrong. And that is my favorite part of every lesson is what can go horribly, horribly wrong. Well, to review, the nervous system is responsible for sending nerve impulses to every part of the body. It's an essential system and it controls movements. And issues can affect the body's ability to control movement, brain function, and even consciousness. And a few nervous system issues include epilepsy, Alzheimer's disease, and Parkinson's. So let's first look at epilepsy. Epilepsy is a nervous system disorder that interrupts nerve cell activity in the brain, which causes seizures. This condition can be dangerous even in mild cases, since seizures can occur at any moment, such as while the patient is driving. Imagine you're driving and then all of a sudden you're having a seizure. You can see how that can go terribly, terribly wrong for the person driving and nearby people driving as well. So this is what a partial seizure looks like within the brain, where one smaller part of the brain is affected, and then a generalized seizure is the entire brain is affected. Symptoms of epilepsy differ depending on whether there is abnormal cell activity in the entire brain or just one region of the brain. And these symptoms can include staring, confusion, unconsciousness, uncontrollable twitching of the arms and legs, or muscle stiffness, changes in emotions and senses, dizziness, tingling, or flashing lights, repetitive movements such as pacing or fidgeting. What are some of the risk factors for epilepsy? They include being a young child or over the age of 60. So it's very young to fairly old. Um, those who are young and then fairly old. If you have a family history of epilepsy, you may have a higher risk of having epilepsy or experiencing epilepsy. Head injuries, brain infections, or damage from vascular diseases or stroke. So any type of brain injury, head injury, or infection that can lead to epilepsy. Dementia, that's more common in older adults, so that's why. Childhood seizures from a high fever, and then prenatal injury and developmental disorder. How do you treat epilepsy? Well, treatment can help lower the amount and intensity of seizures and possibly get rid of seizures altogether. And here are some of those options: medication, surgery to keep seizures from spreading to other areas of the brain, or remove the area of the brain causing the seizures. Or the vagus nerve stimulation is they have a device placed in the chest and it sends electrical bursts to the vagus nerve and brain. There's also the ketogenic diet, or keto, and that is a strict high fat, low carb diet. So that can be an extreme alternative to epilepsy. How do you prevent epilepsy? Epilepsy can be caused by multiple factors or have unknown causes depending on the patient. This makes prevention nearly impossible. However, since the risk factors for epilepsy include head injuries as well as brain infections and damage, one prevention strategy is to avoid these risks. A healthy lifestyle, including using head protection, wearing a seatbelt, can help lower the risk of head and brain damage. Moving on, we have Alzheimer's disease. It's an ongoing condition that impairs memory and mental functions by destroying brain cell connections, causing brain cells to deteriorate and die. Here's a healthy brain. Then you have a mild Alzheimer's disease. You can see how the brain tissue is a little different. And then severe, where it's actually, these pictures should be switched. This is normal. This is half a normal looking brain. This is half a deteriorated brain. And this is a full deteriorated brain due to Alzheimer's disease. I don't know why they switch the pictures like that. Symptoms continually increase as Alzheimer's disease progresses and can include forgetfulness, confusion, memory loss, repeatedly saying or asking the same thing without realizing it, regularly losing things after putting them in strange places, forgetting names of family members and common objects, inability to remember the day, season, or their current life situation, inability to find the right words to communicate, read, or write. Decreased cognitive ability, especially with math, difficulty reacting to problematic situations, difficulty completing everyday tasks that require multiple steps, behavioral changes such as depression, mood swings, distrust, irritability, and wandering. Alzheimer's disease risk factors. What are some of the risk factors? Well, aging, especially if you're older than 65, you may be more likely to get Alzheimer's disease. Being a woman, especially since women generally live longer than men, that means they're alive for a longer period of time after 65, so they have a higher chance of getting Alzheimer's disease. Having genetic mutations or a close family member with the disease, head trauma, or cognitive impairment, lifestyle and heart health issues such as low social interaction, smoking, high cholesterol, poor diet, lack of exercise, etc. Alzheimer's disease treatment. There is no cure for Alzheimer's disease. Treatment options can help patients maintain functioning and independence through medication, protective environment, handrails, good shoes, fewer mirrors, and no clutter. Regular exercise and good nutrition can all help Alzheimer's. Currently, experts do not know how to prevent Alzheimer's. However, suggestions that may have preventative effects include lifetime involvement in physical, mental, and social stimulation, controlling blood pressure, cholesterol, diabetes, and weight gain, and a healthy diet. And lastly, we have Parkinson's disease, and that impairs movement. Movement often becomes shaky, but can also stiffen and slow. So shaking, slow movement, stiff muscles, poor posture, loss of unconscious movements, speech and writing changes. Here are the risk factors: age, being over 60, being male, family history of Parkinson's disease, and regular contact with herbicides and pesticides may increase the likelihood of Parkinson's. Here's how we treat Parkinson's. It's also incurable, like Alzheimer's, and the treatment is all aimed at managing symptoms, and they may include medication, surgery to implant a device that sends electrical pulses to the brain, lifestyle changes like regular aerobic exercise, physical therapy for balance and stretching, and prevention. Currently, we don't know how to prevent Parkinson's disease since the causes are unknown as well. However, there's some research showing that caffeine, green tea, and regular aerobic exercise may help reduce the risk of developing Parkinson's disease. All right, well, that's the summary of the 3 issues we looked at today: epilepsy, Alzheimer's, and Parkinson's, that can all develop from a nervous system issue. All right, so that's the end of nervous system 1, and I will see you all next time to move on to part 2 of the nervous system. All right, so if you have any questions, message me and I will get back to you as soon as possible. See you guys later.